Hello, welcome back to Health Communication class. Our perceptions and interpretations of the world are shaped by underlying theories. So it's not like we need to read academic texts about the theories before using them. Well, just like you don't need to read texts on reproductive medicine before having a baby, because theories are embedded in our everyday lives. And theories are an integral part to the scientific process. They help inform the questions that we ask, the methods that we use, and how we interpret our findings. And because theories are powerful influence on how evidence is collected and analyzed and understood, it's both like a scientific and a practical thing when we examine them. So theories aren't just about development, they're also about application. And applying theories to real-world problems can lead to practical solutions and interventions. And in health communication, theories can help us design more effective campaigns and understand health behavior and improve health outcomes. Hypotheses are explicit, they're out there, they're known, but when theories are not the same way, they're not out there and really clear, it's just their power to clarify or to confuse can cause problems or go unnoticed when they're explaining something. So it's just really critical to make these theoretical assumptions that we have explicit so that they're really clear, so we can scrutinize them clearly and also be open to revisiting them in light of new evidence. And so a theorist or a scholar might write about a theory and then revise it as things change in the world. And so this is a common way that we add new knowledge to the information that we have. So, that studying theory in health communication is not just an academic exercise. It's a vital practice that helps us enhance our understanding and inform our actions to help figure out what's going to lead to better health outcomes. So in our talk today, we want to look at the media effects on health. And there are a lot of theories that connect. And the first one to mention is called agenda setting theory. This is a theory that suggests that media coverage makes certain issues more prominent by, just covering them more than others. So, for example, if there's a particular event going on in the country, there's always a wave of news that goes out there in our national news to cover something, whether it be a riot or a natural disaster or whatever things that are big. And so these things inform, and the media does play a role in that, in setting the agenda. And that's why we call it agenda setting theory. And so how do they set the agenda? Well, they're looking for information that's out there that's timely and is interesting and that will draw readers' attention. And so there's a formula for that, and there's a way that they work to figure out what things are going to be put out there. And so agenda setting theory is a theory showing that there's a model for that. And priming theory is something that looks at how news coverage of health issues influences our knowledge. So it's kind of similar to agenda setting theory, but priming theory looks at specifically, how do we think about a particular health problem based on the information that we have been given. So we think about priming you with information. That's kind of what we're looking at. So for example, media coverage about heart disease might highlight the risks of stuff like unhealthy eating, but that information about unhealthy eating primes audience to think about diet when considering heart health. So at least it might help connect the issues for the viewer. And the media exposure gives depth to understanding. And that's what that connection is looking for. Also, I want to mention framing. It's another term that's common in our talk about how we understand the media influences. Framing refers to how issues are presented in the media and how those presentations influence the way viewers understand those issues. So, for example, if media frames obesity as a result of personal choices rather than socioeconomical factors, then the viewer might get that view also. So when I hear news spokespeople talk, I try to listen for the words that they use to understand the bias that they might have. The framing words that they use are things like the attitudes that come out about their view on the topic. And so, we might notice sarcasm. We might notice something in a positive or a negative light. And so those framing words, I think, are much more commonly picked up on by a younger audience who is used to having to sort of evaluate all information all the time. Whereas an older audience was used to being able to maybe trust the source of information more, because times change. And that's what's interesting about theories, is that when we introduce theories, what we're doing is we're preparing our thoughts now and our knowledge now for how it might influence future situations and subjects and things that happen later in the world. And so in that respect, it's really interesting that it helps us prepare for future problems and future discoveries and things that we want to tackle. So we've been able to talk about agenda setting theory and priming theory and framing. And so now I want to get into some deeper theories that help us sort of understand the topic. And one of them that is talked about by our book is called cultivation theory. Cultivation theory suggests that the stories that are told by media, especially television, shape the way that we view the world. And so, for instance, if a TV show routinely portrays doctors as infallible, then the viewer might develop an unrealistic expectation of healthcare professionals, right? Because how they're viewed is how it's done. So one of the things that as a paramedic that I feel like is interesting is that media portrays paramedics as always rushing all the time, right? They even say rushing someone to the hospital. And the truth is that's rarely done, because there's so much that we do for them on the ambulance that there's not as much rushing involved unless we're rushing someone to emergency surgery, right? And so those things are misconceptions that are thought of by the audience because they've been exposed to those things. So moving on to social cognitive theory. Bandura created this theory, and some people even can call it the Bandura social cognitive theory. It's something that proposes that media influences our values, our thinking, our behavior, all by modeling behaviors that prompt observational learning. So it's like you watch something on television and you yourself have not experienced that in real life. But because you experienced that on television, then that fills in and becomes your exposure now. And so children, in a study that they looked at in the early 60s, children were shown television, and the research that they did in this Bandura's famous Bobo doll experiment demonstrated that children learn and imitate behaviors that they've observed in others. And my best friend has a 2-year-old, and one of the fun things about her right now is that she likes to do a lot of teaching, right? So she herself has been sort of the person, she's been the baby that's always been given instructions, right? Like, don't do that or do this. And so now she's in a spot now where she's imitating that behavior by doing a lot of teaching to adults. And it's just really cute. But the thing is that this experiment and this way of thinking shows that media does influence our values, our thinking, and our behavior. And so it's important to filter and know what we're putting in. The social comparison theory is something that suggests that we determine our relative success or failure by comparing ourselves to others, either interpersonally or through media. So, for example, if you see a fitness influencer on Instagram, it might make someone, feel inadequate about their own body. There was a study by Franduli in 2015 that found that more time spent on Facebook was associated with higher levels of body dissatisfaction among young women. And in 2015, when that study came out, it went viral, and everyone was interested in how young women were going to be able to perceive and make it through the world when they have so many negative thoughts about themselves. And the negative thoughts are just really were related to the fact that they see all these positive images and they aren't that, and they don't have these same wonderful things that they're seeing. And the reality is that everything's made up, right? Like, the picture that we see is not as awesome as it really is. It's doctored, or it's with the best lighting, or whatever the best situation. And so knowing that we can compare ourselves to things that we see in a way that influences our thinking is important to know. The social comparison theory, the title comes with the name, so it helps us know that this is the theory that allows us to make ourselves through the world. And I definitely think about teenagers, doing nonstop comparison and that kind of judging. And that's why that study was done on teenage girls that showed that I would imagine that would be one of the perfect audiences who were interacting with that media, and also at a stage in their life where they're not connected with their families as much when it comes to their opinions. They now move to comparing themselves to their peers. There's a knowledge gap hypothesis also out there, and the knowledge gap hypothesis predicts that people with more education and financial means gain and retain more from the information they encounter in the media. So, for instance, those with higher education might better understand complex health articles that were in the New York Times as compared to someone that has less education. There was a study in the 70s that found that as the infusion of mass media information pushes itself into a social system, the population with a higher socioeconomical status tend to acquire the information at a faster rate than the lower socioeconomical sections. So that gap in knowledge between these segments tends to increase instead of decrease. So when we have a major event, folks who have more money, who have more resources, are going to find out about it faster and find out more information. And so if we think about how could that happen, well, it might depend upon that person's job and the ability that they have to even look down at a phone, right? And the kind of phone that they have, and the all of those things play into it. And so we think about this knowledge gap hypothesis because some people are getting different levels of information, and we've known since the 70s that for sure that more money means that you have more privilege, and one part of that is just time. You have more time to do those things. So communication inequality is another aspect to this, another level to the layer. And all of these different darts that we're hitting the dartboard with help sort of try to help us think about the landscape of these theories. And so communication inequality refers to the differences in the ability of social groups to generate or manipulate or distribute information. So wealthier communities may have better access to health information. And it may be just related to this connectivity. But Vionsworth in 2006 found that communication inequalities really do also add to health disparities. So that's why, we can see these studies that have helped us look at how information that's put out there, some people are able to get it over others. And if you think about just, gosh, like the old days when you learned everything by newspaper, you had to have the money to buy a newspaper, the time and resources to get the newspaper, right? And for folks who were really had enough money, they got that newspaper delivered to their door. And instead of having to go to a newsstand, or instead of having to get yesterday's paper, or instead of having to hear from someone else that could read, right? So I'm just thinking about like what it used to be like, right? And now we can think about when we have all these apps and all these information sources and how they can be related to the socioeconomical condition, how that person might be able to get information or not. So, in summary, health communication theory has really influenced our thinking and understanding of health issues. We talked about this agenda setting theory, for instance. It sheds light on how our media coverage can steer public attention towards public health concerns. The priming theory highlighted and looked about how media can shape our knowledge and perceptions about health risks, like unhealthy eating contributing to heart disease. We talked about framing theory and how that demonstrates the power of the media to shape our understanding of the health issues. We also looked at cultivation theory and Bandura's social cognitive theory, because they show how media narratives and behavioral modeling in media can shape our worldviews and influence our behaviors. The social comparison theory looked at the impact of media and the influencing of our self-perception and our body image. The knowledge gap hypothesis and communication inequality point out the disparities on information and how we get it, how we distribute it, and how that's based on and connected with things like education level, access to resources, and money, having that to help. These theories altogether really illustrate the impact of media on our health perceptions, behaviors, and our decision-making stuff that we use to process and think through stuff. And this underscores the importance of media literacy and the critical thinking and navigating health information and misinformation in today's media saturated environment. We're lucky that the theories that we're talking about have the names of what they mean in the titles, right? So that's one thing that I think we really have going for us. Now, media misinformation is a pretty big deal, pretty big issue, because if misinformation is out there, then it could change someone's behavior. And that behavior change, maybe it's not a big deal if we're doing something small, but if that behavior change is affecting our lives, then we need to take account of it, right? So health media misinformation refers to false or misleading health information that's put out through all the different media channels. And information can range from simple inaccuracies to deliberate misinformation, which would be designed to deceive for a specific reason. And the impact of health misinformation just can't be underestimated. One of the things is, a survey by the Kaiser Health Foundation found that at least 4 in 10 people have encountered health misinformation. And so research indicates that falsehoods spread faster and further than accurate information, and that all can cause negative effects. The World Health Organization also found that an excessive amount of information about a problem, especially if that information that's put out there is unreliable, can negatively impact people's health behaviors also. So, to illustrate the power and danger of health misinformation, let's look at the case from 1998. A British medical journal, The Lancet, published a study claiming a link between the measles, mumps, and rubella vaccine, the MMR vaccine, and saying that there was a link between the MMR vaccine and autism in children. So this claim was later debunked, thoroughly debunked, and the paper was retracted. And out of the reviewers, I think all but 2, like out of 14 or something like that, had retracted based on bad information. But it was too late because the high-ranking journal that put this information out was taken so seriously that the media coverage of this flawed study sparked widespread fear and confusion and led to a decline in vaccination rates. And then if the vaccination rates go down, then we have a resurgence of preventable diseases. And this happened in several countries. And so this case says, hey, the potential of media misinformation to incite harmful health behaviors and public health crises is real. And so I think that, for example, people have been wearing masks since from long before I was born because of just the flu, right? And so for misinformation to be out there saying that masks are bad just makes no sense, because I can tell you as a healthcare provider, that's how we protect everybody, not just from COVID, but even in surgery, or even when we talk, we get little particles that come out of our mouth all the time. So it's just, it's knowledge like this instead of the disinformation that can come out that's important to know about and understand. And in the digital era of today, the problem of health misinformation has really been blown up because it's really easy to get information out there on these social media platforms. There was a study that found that a high prevalence of health misinformation on social media, including the spread of medical fake news, really there was a study that was showing that there's a high prevalence of this health misinformation out there, and also the medical fake news. And so it just underscores that, hey, we have to be vigilant, and critical thinking is important when interpreting health information online. So combating this health misinformation is just a responsibility that we all have, and it requires that all of us speak up, health professionals and people that know the truth about the facts. And so the World Health Organization, for instance, is working with social media platforms to flag and try to help remove false health information, so that there's a source of trust that can be put on that information. At the same time, individuals can play a part by verifying information from credible sources before sharing it. In general, this health information that ends up being misinformation poses a significant risk to public health. And this MMR autism controversy is just one way, or, one thing that really shows that off well. And so as we navigate this information age, all the time getting information, and now I guess the thing that worries me is deep fakes, right? I'm watching YouTube videos that have deep fakes in them. Like, it's easy to tell, but It's because I'm looking for it. So how much is this going to really influence us? And so it's just really crucial that we learn to discern reliable health information instead of the misinformation. So when we think about all this information, there's a lot of media influences out there. There's social media platforms, there's health and medical websites, things like WebMD, Mayo Clinic, Medline Plus. There's news media that's out there, and podcasts and online forums and blogs. All this information, even things that come through Google or an AI bot, need to be confirmed. And it's just wild and crazy that when our grandparents were trying to confirm information, they would go and look at an encyclopedia, which would be like all the information of the era, right? Almost. And so I'm exaggerating but to show a point that now things are changing all the time. And this change all the time means that we need to have sources that help us identify what's real and new. And so one of the things that makes another level of concern, but also interest to this, is there's something called direct-to-consumer advertising, DTCA, direct-to-consumer advertising. And this refers to the practice of promoting prescription drugs and medical devices, typically to patients rather than to healthcare professionals. This kind of advertising is typically done through media channels like radio and television, and even more recently, like YouTube ads and stuff, right, on social media platforms. But having this type of advertising dates back into the 1980s, because in the United States became one of the very few countries where this practice is legal. So it's just like, I think, New Zealand and the United States, where the direct-to-consumer advertising can happen. And so this kind of advertising that's out there now means that everyone has an opportunity to challenge their doctor or to be their own doctor. And there are some benefits. First, it can increase patient awareness of diseases and available treatments. It can help lead to earlier diagnosis and treatment because the patient would want to check that thing out. And it also can encourage patient autonomy and empowerment by helping give information that allows patients to take an active, role in their healthcare decisions. But the direct-to-consumer advertising also has some issues because, it can lead to overprescription of medicines. As soon as you hear that something new and great is out there, people flood to it. I think a lot of people are familiar with a couple of different diabetic drugs that have been out there that have shown to help with weight loss. And then all of a sudden, those diabetic drugs that were supposed to have been going for the diabetics aren't available anymore because they got taken off the shelves. I'm not taken off the shelves, but they've been used up by all the folks that were there for the other purpose, right? So we want the diabetics to have them because they're there for primary life-sustaining need. And so there's a balance of information problem that also comes out with these direct-to-consumer ads. There was a study that found that while most of these ads are compiled within the FDA regulations, they just lack information about alternative treatments. And of course, they're advertisements, right? So they exaggerate the benefits of the advertised drugs. And really, if we have a medical problem and we see a drug that might help us, then of course it might spark our interest. And so it's easy to, in medicine, when we have a problem, look for simple, easy, awesome solutions. And when we see a commercial that gives it to us, then it's, we go for it. And when we go to the doctor's office, we face the reality of really what's happening with us. Instead of the fancy commercial anymore, it's really us. And so these kinds of commercials I think are good and bad. But the way that the direct-to-consumer advertising has an influence on healthcare costs is really argued that it might drive up healthcare costs because there's an increased demand for these costly branded drugs, just like I said with the diabetic example. And while the direct-to-consumer advertising can play a role in patient education and engagement, it's also crucial to address the concerns around this practice because it really makes us think about how, hey, we need stringent restrictions to ensure that the information that we're getting is accurate and that there's a balance of drug information. And really when it comes down to it, we have to be able to trust the physician that we're getting the medicine from and the pharmacist. Please know that that's the backup for everybody is the expert, is the pharmacist. So now that we've had a chance to look at these kinds of media influence theories, I want to get into health campaigns and interventions. And some of this comes from our chapter 14. Health campaigns and health interventions are two strategies that aim to educate individuals and encourage positive behavior change. And they might share a common goal, the health campaign and the health intervention. Their methods are different. Community-based and school-based interventions actively step into the lives of the target audience, but campaigns might rely more on persuasive types of messaging. So let's start with mass media campaigns. Our daily media consumption often includes messages that promote healthy behaviors and discourage unhealthy ones. So, for example, you may have heard of radio spots about emergency preparedness or sustainable food sourcing. These kinds of public service announcements or billboards out there are also just platforms for these campaigns and work to reach out to a broad audience. So now let's go ahead and apply this to the theory world and discuss some of the theories and models that help guide these campaigns. The first one is TTM, and it's called the trans-theoretical model. The trans-theoretical model helps identify where the target audience stands in their journey towards the specific health behavior change. It's like, where are they at in making the decision? And I had a friend of mine who tried to convince me to hold a sort of like a Tupperware party, like hold a party to where I would invite my friends over, and there would be a vacuum salesperson that would come over, and the vacuum salesperson, would give free gifts and do demonstrations. And my friend was trying to convince me to do this, and it happened through like 3 phone calls. I'm like, no. So in the trans-theoretical model, like I sort of cut things off before I could even get into the decision process. So I would have been at the very beginning. So this trans-theoretical model is something that enables campaign designers to tailor messages to different audiences at various stages of change. So the stage of change I was at wasn't even in the consideration, maybe. So we would call that like step 1 or step -1. So the trans-theoretical model is like a roadmap for health behavior change. It helps identify the different stages that people go through when modifying behavior. So, for example, a health campaign promoting regular exercise might tailor messages for different stages. So those that were in a pre-contemplation stage, that whole negative number or that 0 number, or unaware of the lifestyle's negative effect, might also be a negative number. Or it could highlight the benefits of exercise, right? So that would be maybe like a number 2 into the step. So for individuals that are in the action stage, already incorporating exercise into the routine, the campaign might provide tips to maintain this healthy habit. So they might be at a level 5. So we've talked about people in negative numbers all the way up to 1, 2, maybe a 5 out of to be able to see where they're at in the decision-making process. So this trans-theoretical model basically says that it helps advertisers, media designers, people who are trying to put together messages of targeted influence, hit the person at the stage that they're at. So if you think about someone that's going to be someone that's interested in buying a car, we know they're interested in buying a car when they walk to the car lot, right? So they're at a pretty high level, as opposed to someone who has a vehicle and is not thinking about it. So trans-theoretical model is a funny word and it has multiple syllables. So it's just important to know that it's where at in the process of the decision making. All right. The extended parallel process model is an instrumental at really looking at and designing fear appeals. When I teach persuasion class, when we talk about communication persuasion, a lot of appeals, a lot of ways that people are convinced to do something are done through fear. So that's why this is one of the considerations here. So this extended parallel process model gauges the likelihood of an individual performing the behavior would avoid a potential threat. So it helps design fear appeals, which are messages that scare people or push them by motivation to change their behavior. So for instance, an anti-smoking campaign might use this kind of model to create ads that show the damaging effects of smoking on the body, or aim to motivate smokers to quit. So these kind of fear appeals are pushy, and what's been shown to be the most helpful form of persuasion is usually to elicit a moderate amount of fear appeal. So usually some small amount helps push towards change. The next one to discuss is called prospect theory. Prospect theory concentrates on message construction in terms of gains or losses. It can highlight the benefits of following advice or the consequences of ignoring it. So this theory frames messages around potential gains or losses. And if you have studied sales or sales theories, some of these also connect and relate. So prospect theory, it's kind of like if there was a campaign promoting the flu vaccination, they could use prospect theory because it might frame the message as a gain. Hey, getting vaccinated reduces your risk of flu. Or it could be as a loss. Hey, not getting vaccinated increases your risk of flu. So these are considerations that are put out there when we look at prospect theory. And hey, how do we push this information? How do we push this message? The next one is called the activation model of information exposure. And the activation model of information exposure focuses on the sensation value needed to retain attention to a message. So it takes into account the need for sensation and for something with strength to the argument. The activation model information exposure considers the sensation and argument strength. So, for example, a sex health campaign might use shocking statistics, right, about sexuality transmitted infections, and then add that up with compelling reasons to practice safe sex. So you've done a high sensation plus a strong argument. The high sensation was, hey, shocking statistics about STDs. The strong argument was pushing for reasons to practice safe sex. So what this did was activate this information exposure. And that's why they call it the activation model of information exposure. So this helps us look at what's sensational, and then what's needed to back up and remember that the connection, so that the action is taken. The next one to mention is called the elaboration likelihood model, and this has been around for a long time, the ELM model. The elaboration likelihood model looks at how people process messages. considering factors like message processing ability, personal motivation, and their ability to respond. So we're looking at how a person is, right? How do they think through stuff? What are their needs, and because this model explores how people process persuasive messages. Everyone's going to process messages based on who they are, what's going on in their deal, in their life, right? So a campaign promoting healthy eating could use this elaboration likelihood model by providing nutrition information to those who are motivated and able to process the detailed information. But then at the same time, give simple slogans or appealing images, which would be more like a peripheral route for those who are less motivated or able. So another example for this elaboration likelihood model is for my podcast. I put out a podcast that's sometimes 30 minutes, sometimes 40 minutes long. Not a lot of people watch the podcast, but there are a huge number of people that watch the short blurbs that I put on the internet that come from the podcast, right? The reels or the shorts that come out of it. So just like that, the elaboration likelihood model is set up to show that, hey, if I'm going to influence a wide variety of people, then I need to be able to put both things out there. And if we think about it, the person that is going to watch the entire episode to the end is a person who is now prepared to be a thought leader in that area. And so we can see that someone that's dedicated that much time versus someone who's only listened to a 30-second clip are just much different people. But they still might need a message that would give them influence. And that's why we are able to look at it, at the messages delivery this way. So next is the health belief model. The health belief model predicts action taken to prevent or screen for illness by examining the severity or susceptibility that somebody might have. The health belief model predicts actions taken to prevent illness. Okay, so a skin cancer prevention intervention could utilize something like this because it would emphasize the severity of skin cancer and how susceptible somebody is, and then also the benefits of prevention methods like using sunscreen or wearing hats. So the health belief model predicts how much likely it is that someone's going to take some action. So think about your own self. What things are you predisposed to when it comes to health? What things do you think about? Because it applies to all of us. Some of us eat right for a certain reason. We take our medicine for a certain reason, and the health belief model applies because we're all examining the severity and the susceptibility, and so the health belief model helps us do that. Also, there's something called the integrative theory of behavior change. And the integrative theory of behavior change assesses the likelihood of performing a behavior. So the key variables there would be like attitude, the intention to perform that behavior, or other things that folks have to deal with, like environmental restraints or just the ability to perform the task or the support to get it done. And this integrative theory of behavior change considers a lot of variables out there to predict behavior. So a campaign to reduce binge drinking among college students might consider the students' attitudes towards drinking, their intentions to drink, the norms in their peer group, the self-efficacy in resisting peer pressure, and also the availability of the alcohol. So you can see that in this integrative theory of behavior change, we're looking at a lot of the things that are out there in the person's environment, both in their mind and and their motivations and the people around them. And so that sort of encapsulates a lot as compared to the health belief model that we originally talked about. Only looks at the prediction. Hey, is this person going to take action to prevent or do something to make this better? So now that we've talked about those two, I want to talk about the social cognitive theory. The social cognitive theory elucidates how people learn behaviors from observing others. So personal goals, what they expect their outcomes to be, these are some key variables in the theory. And the social cognitive theory explores how people learn behaviors from observing. An intervention promoting mental health might use social media influences to share their personal stories, hoping that the followers would learn from their experiences and seek help also if needed. Learning behaviors from observing others is something that's done from childhood up, from the animal kingdom around. It's all about how we're figuring out things in our environment. And I think that an example is just that if we're around more healthy people or environments or things, then we'll participate in those and have a more likely to participate in those things. So social cognitive theory really is focused on what happens when we observe others. The theory of planned behavior is next. So the theory of planned behavior determines the intention that someone has to perform a behavior in a way that considers important factors like attitude, behavioral control, and social norms. And it's more than that because it's also about the ability to predict the behavior. So a campaign that encouraged recycling could use this theory of planned behavior by promoting positive attitudes towards recycling. And they would do it by like highlighting easy ways to recycle and showcasing that recycling is a societal norm. And so this is just like you assume that everyone is going to do it and make all of the positive messages and intentions positive. So that was the theory of planned behavior. And, you know, in our everyday lives, we're constantly bombarded with the multitude of messages out there. And a lot of these are carefully crafted using deep psychological and communication theories, like some of the ones we've been able to look at. And these messages are a part of a larger health campaign or intervention out there a lot of times. And they're designed to influence our behavior and attitudes and decisions. It's not just a quick commercial. It's not just a simple message. These things were thought through by many people for lots of reasons, and a lot of background goes into it. But it's important for us as consumers to critically analyze the messages and understand the theoretical underpinnings that drive them. Because if we can understand what's been done to put together a message for us, then we can understand if this is something that's been done to help us or to hurt us. You know, a lot of these models can be used to our benefit. And at the same time, I feel like that they could be used in manipulative ways also, especially if things like marketing tools or AI are used to help figure us out as consumers. And this highlights the importance of being an informed consumer. So understanding not just the content of the messages that we receive, but also the underlying strategies, the theories at play. So by doing so, we can make more informed decisions, navigate the world of media, and communicate more effectively. When I was in advertising, when I was in journalism school, I took an advertising class that had me look at commercials. And the whole purpose of me watching commercials was for me to dissect the messages that were being delivered and the theories that were behind those messages. And sometimes the theories have a lot of connections with seeing something that's cute, or something that makes us feel patriotic, or something that activates our sex drive, or something that shows off an example of what we would like to be, or an example of ourselves. All these things are angles that are persuasive communication messages that were planned that way. And so when we are designing and implementing messages, it's a deep process. And so as a consumer of these messages, we have to be able to do the same thing. We have to sort of be able to dissect and understand, where is this information coming from and why is it coming? And what I do is I commonly try to pull my information in from multiple sources, and as a common backup, then I go to a thought leader. So I don't know about you, but in my life, I'm a thought leader on a range of topics for some people. But also, I have go-to people that I seek out for their advice, because they're my thought leaders. And so this is part of putting together a trusted network that helps our critical thinking and helps us navigate the world. And so it's not like we know the expert in every field for everything, but over time, we should be able to second guess ourselves, and we should be able to not just accept information at face value, because there are a range of things that go into this influence, a range of theories and manipulation that occurs. And so it's sort of like, this is something that could be used for positive or negative. And so we want these theories to be used for positive, right? Because our goals are good outcomes, and through good health messaging, we hope for that to be. And so I want to thank you for hanging tight with me for this long lecture looking at a topic as deep as theory. For what we talked about today, I feel like we've just skimmed the surface, but we've been able to at least cover some of the major theories in health communication. And I hope that it's informed and helped you as you think through the reading assignments and discussion board assignments for our class this term. And I wish you the best. Thank you.